What's up, guys? John here. Titan Talk Tuesday has officially begun. It's been a good week. It's going to be an even better week, I think, at the end of the week. A lot of things coming from Titan Medical Center. A lot of things went on this last couple weeks. It's just been event after event, and Titan, we've basically been taking over all these places we've been at. So it's been nuts. And like I said, great at the same point. I mean, some of these events, like this last weekend, we were down in Orlando, Florida, and we were at the Europa Expo 2019. Of course, we dominated that. I think it was really, really cool. We had special limited edition, our Titan Strong, no other alternative shirts were out there. That was a big hit. We're going to be having those for sale. A lot of people have been wanting to buy those, so it's definitely a motivational shirt. I love it. I love that we came up with it. It was really, really cool. But it was awesome down in Europa. And Europa is like a fitness expo. I know I've talked about it a couple times. But we've had everybody, a good amount of the team. I think about 75% of the Titan Medical Center team was there as far as Titanettes, athletes, and stuff like that. There were some people there with us in spirits. They were around the country that couldn't be there with us. And we love you guys. So we represented for you guys hardcore, I promise you. We represented the Titan way, and the Titan lifestyle was definitely there in full effect. And a lot of people felt our presence. It was really, really cool. Even my attorney said, hey, listen, my paralegal is in the bodybuilding fitness world, and her boyfriend's a competitor and stuff like that, and he heard good things about you guys and seen you guys at Europa. So that was, that's awesome for me. When we hear about this stuff or hear about all the shirts in the gym or stuff like that, it's really, really cool. But Europa was just awesome because, like I said, it's kind of like a Titan Medical Center reunion at that point, and we have a huge booth and a big presentation. So we had all those athletes out there, and we've gained more and more athletes and Titanettes and stuff like that. And people have come out and drove from different states to come visit us or some of these athletes and to take pictures with us and to ask questions. And I mean, it's just a really, really overwhelming effect when these people come up to you like, wow, I see these videos, or, how are you doing this? Or, just hit you out of the blue. You have no idea who you affect by some of your videos that are out there. You may never know, but you may find out because people might come up to you and say, hey, listen, I've seen that. So just, be cautious about what you're putting out there because you never know who's going to see it. Anyway, but it was awesome to see that, take pictures with everybody. We also did our Clash of the Titans, our Titan takeover of Iron Religion Gym. Thank you so much to the owner and staff of Iron Religion Gym for letting Titan Medical Center come in there and do our thing and do our takeover. So we had, I think, like 27 athletes and Titanettes in there, right around there, I think. So it was cool. We got all kinds of video, all kinds of content. So if you see a lot of content of the event, that's probably why. We want to just get it out there, show you guys a whole different effect of Titan Medical Center. Now, granted, there is a lot of gym pictures and stuff like that. We did work out, okay? You got to stay in physical condition one way or another. Whether it's hiking, you're swimming, you're lifting in the gym, you're doing calisthenics or stretching, like we show in these pictures. So we have girls that are very, very soft and feminine, right? And they don't want to lift weights. We have some girls that want to lift weights and be stronger, right? Everybody's goals are different. And Titans are of all different form, all different colors, sizes. They come from all different backgrounds. I mean, the caliber of people that we have together is great. All different kinds of characters and come from all different types of backgrounds. So you really learn about these different people, and it brings you to a more of an open-minded effect to, you might have not thought about this until somebody brings it to your attention. Then you really think about it, or maybe possibly think about putting yourself in their shoes. So it's really, really cool, and I think we've just evolved in that effect. And like I said, Titan Medical Center is for everybody. So, we can have younger people as far as wanting to do different goals. They might not be a good candidate for hormone replacement therapy, but our vitamin amino acid injectables might be a good play for them. Or we have our older people that might need hormone replacement therapy, or your mid-30s that might need it. It just all depends. And that's why, our hormone replacement therapy, you need to have blood testing and you need to see a medical doctor. You want to make sure that's there. So at that point, when you're doing any of these therapies, make sure you're seeing a medical doctor or a nurse practitioner or somebody to that effect that has this medical licensing that can give you this advice. The blood testing you can get very easily. You can usually get that from us. Some general practitioners may be able to do it. we have probably the least expensive blood testing in all of the country. And you can even a la carte. So that means you can pick one test out of all of them and just pay possibly, what, $25, $20. It really just depends on what the test is. But you can do a full panel through us. And I talked to somebody today online, and they said, you know what, I'm going into my general practitioner, but I'm really scared that he's going to turn me down from getting these tests. I don't think that he's going to let me or prescribe these tests to me. So I said, well, here's another option for you. If you want to do all these tests and you want to do them through us, the Titan Medical Center, you can do it for $150, and that's what our full male panel is for. And that covers a lot of different things. And even some of these people that say that their labs are covered by insurance and stuff like that, everybody's insurance is not the exact same. So some insurance companies do kick back on you. It's a lot more money than what you pay the $150 for. But once you get into that deal, it's really, really hard to get out of without paying that exuberant amount of money or negotiating it down, and you're still probably going to pay more money than that amount that you could pay with us. So at that point, you have these results, and you can take that back to the general practitioner, and now you have results to go after. Now they really can't turn you away because now these labs were done, and at that point, you have some sort of evidence of what's going on, right? Some sort of indication, and maybe they'll treat you from there. Maybe they won't. At that point, you can go to somebody else and possibly have these results like us or somebody else, and they can treat you or help you out possibly. So that's really a good effect to look at with the blood work. One, you're monitoring what's going on, right? You're not having to wait exuberant amounts of time in an office and possibly go into a doctor that does not want to do the blood tests on you. Will turn you down like this. You've been in there 5 minutes, you told them some symptoms, you've asked them for these tests, and they still don't want to do it, or they want to do all these other testings before that. Why? When you can get those results and get them done, expedited results, and then at that point you have something to go on, right? You have some sort of ammo, you have some sort of indication, like I said, and you go to him and you say, hey, listen, I got these tests done and this is kind of what came back. Can you help me out? And at that point they can go on from there. So I want to say hi to everybody. I'm sorry I kind of went into a little raving rant. I'll definitely do some info. So CJC consider starting. I'll get into that next. Biceps up 100. Oh yeah, Big Drew, what up? Yeah, Big Drew just got on the Titan Medical Center programs and therapies. And man, the first one that we always talk about here is Hercules Potion. And I know you guys probably get over, you're like, oh, Hercules Potion. And you guys that have tried it or that are on it, you guys definitely know what Hercules Potion is all about. And Hercules Potion, I pretty much ask like all the athletes, or like, I have Lee Shalacott, in from town, and her boyfriend Kevin, and they haven't got to try the therapies either till now, because now they're patients. They got to see the doctor, they fill out their patient paperwork, and that was it. Real simple, real easy. But they love the Hercules Potion. The reason why is because it just gives you an awesome pump effect as far as vasodilation. It lets the pump in the muscle stay there longer. It stays fuller, so you feel great. It lets you do more strenuous activity usually most of the time. And this doesn't have to be in the gym. This could be hiking. This could be walking around at Disney like I've done before. Who has been there with their kids? Trust me, it is. It's definitely something that will take the life out of you. I promise you. So you want that extra goodness of natural amino acids to get you through that day. I'm telling you. So, it's not some miracle drug, but it definitely helps in a lot of these different ways. So if you're looking for better vasodilation, muscle pumps, more strenuous activity, right? It's got some liver function properties as far as helping liver functions. It's got proline in it, which is a collagen-based amino acid. I was talking to the staff about that today. A lot of people have a lot of bad joint areas. Lubrication is key, and some people are taking glucosamine supplements. So at that point, this is really, really a good one that covers a lot of the different bases for you. So Hercules Potion was one. So Drew, he definitely does it. And you don't have to spot inject it. You can inject it like a deltoid with a little insulin needle. And at that point, or you can do, some instant gratification when you're doing spot injecting and working out those muscles that day. I did do a little bit in the chest today, but as you can see, like all over it, and I only worked out chest. The arms definitely feel pumped still. So it's awesome and great. Now, I'm not the biggest guy in the block. I'm not trying to be, but I want to be aesthetically good. I want to be around 210 pounds, 6 foot. That's what I am. And I'm right there, 210 to 215, lean with abs. That's kind of where it's at, guys. You definitely want to be there, right? So that's kind of what I'm trying to help you out with. I'm trying to tell you the keys of what I'm doing. It's not about taking mass quantities of stuff either. You definitely can do a lot with a little bit. As far as amino acid injectables, making sure hormones are optimized and you're all there, you're eating, you're training, you're sleeping good, and it doesn't have to be hardcore bodybuilding training. You can do a lot of this training very, very easily, simply. You don't even need to go to a gym. You can start with push-ups, sit-ups, right? I mean, these are really, really key functions to build core muscles and all the other muscles, at least with your body weight, and you can keep going up and progress. That's what it's all about, it's progression. So let's talk about CJC, because he did bring it up. CJC is not a SARM. So a SARM is a select androgen receptor modulator. Okay, so they basically, they've had the testing out, the SARMs and stuff like that, and it's supposed to be a better alternative to possibly testosterone function, use of testosterone for functions and stuff like that. Now, CJC 1295, we were talking about today in the office, is the predecessor and is the more potent effect of the GHRH as far as injectables. So the old dinosaur of the GHRH injectables was Semarelin. Now, Semarelin over a long period of time, as far as that goes, it probably doesn't work as well for you. Stays in the body a lot less time than CJC 1295. So CJC 1295 is a great injectable for GHRH, a growth and releasing hormone. Now, it is a better alternative to growth hormone because A, it's a third of the cost. 2, you might not need growth hormone, so you want to do IGF-1 testing. Make sure you're doing IGF-1 testing before you get on growth hormone or somebody's prescribing you growth hormone. And make sure you're talking to a medical doctor about it, because somebody on the phone telling you that's not a medical doctor or that has a medical license or a DEA license shouldn't probably be telling you to take these things. So make sure you're at least seeing them. You can pick them out in a crowd. You know who your medical provider is. If somebody says to you, I have a certified, board-certified medical doctor, make sure you're seeing the board-certified medical doctor. Don't let them just tell you they have one, right? At that point, make sure you're covering all these bases. Making sure your medications are coming from U.S. licensed pharmacies. I see a lot of smoke and mirrors out there about CGMP pharmacies, 503Bs. Make sure, if it is a 503B pharmacy and a CGMP pharmacy, that means Certified Good Manufacturer Practicing Standards, okay, as far as injectables or sterile compounds. That point, they're going to be an FDA outsourcing facility and on the FDA website. Their name should be on the label somewhere, so you should be able to find it, and you can definitely find out about that 503B and see what's going on. Now, does the FDA ding all pharmacies? A lot of them they do. So at that point, you can look at that and see what's going on too as well. So that's kind of the insight of what's going on. CJC 1295, great GHRH, which leads me into the therapy of the week. We might as well talk about it because it's right there. So therapy of the week is MK677 ibutamorin. So at that point, what is MK677? So MK677 is an oral GHRH. It has shown to raise IGF-1 levels, which IGF-1 levels orally is awesome, right? Usually you have to take an injectable like CJC 1295, which paired with Emperalin is really, really great as far as working with the posterior and anterior. It's like a growth hormone releasing peptide as far as that goes. It works in the same function, but it works a lot better. And them synergistically working together, it does for a great effect. And a lot of patients get great, great results from them. And that's with sleep, raising the IGF-1 levels, just natural overall better quality of life and health at that point. And you're not taking growth hormone, right? At that point, you're not spending as much money and you are not dependent on growth hormone. Your pituitary might not possibly shut down. Now growth hormone deficiency for adults is out there, and there are some doctors that do it, but there are tests they run beforehand, and the medical doctor is treating you very closely, monitoring, make sure that's what it's about. It shouldn't be for anti-aging effects or anything like that. DA looks down on that. So at that point, we don't do any growth hormone for our patients. We have a lot of different other options for them. And like I talked about the CJC 1295 with the Emperalin, bam, pair those together synergistically, they're going to work great for you. Or the therapy of the week, MK677, the oral version of GHRH. It should definitely raise IGF-1 levels, hopefully for you. And at that point, give you the effects of longevity, wound healing, better sleep. At that point, you should get a lot of different effects. I mean, lean muscle building, it should help with. The only thing I do caution with, some of the patients have had some water retention as far as that goes. So at that point, you want to definitely monitor, make sure you're going on clean diet, water. Make sure you don't have a photo shoot the next day or that week. Make sure you're not got a bikini competition. Make sure you just want to build some muscle, and that's what you're kind of going for. At that point, afterwards, you can always, slim down, I guess, do some cardio, get that water weight off, or make sure you're eating very clean and drinking a lot of water to begin with. That would definitely be the optimal way to do it. Does Hercules? Okay, so let's talk about this. Does Hercules Potion contain tea? So no, Hercules Potion does not contain tea. It does not contain tea. So I think you're talking about basically, does it have testosterone in it, right? So no, it does not have testosterone in it. What Hercules Potion has in it is just an amino acid blend. It has glutamine, arginine, ornithine, lysine, L-citrulline, proline, taurine, NAC, and L-carnitine. So it's 9 ingredients for you guys. As far as that goes, the proline is for the collagen base. I talked about it earlier. The arginine, L-citrulline, a precursor of nitric oxide for vasodilation, give you that nice little pump. Glutamine for recovery. We were talking about that earlier. It's in a lot of these different supplements out there. Now, the reason you would take the injectable over the oral form is transportation. It's going to get in the body a lot quicker. 2, absorbency. It should absorb in the body a lot more. It's not getting broken down, going through the gastro tract and stuff like that. So at that point, you should be getting a lot better effect. You should be getting a lot better result. And that's why Hercules Potion, like right away, people know right away, within 30, 45 minutes after injecting, they're like, oh man, I'm already starting to feel a pump. Now when they get to the gym, they start doing 1 or 2 sets. They're like, oh my God. Drew is the same way. Like, I think my arms are going to explode. And that is just like, wow. You're like, if you're into it, you're starting to get that pump like that. You're like, this is real. Even Elise, she was telling me, she's like, it's really hard for me to get a pump and stuff like that. But at this point, like, it's just really, really cool, I guess. And I'm like, she's like, this is giving me a pump. And I'm like, this is awesome. When you talk about it, it's one thing, but when you have it and you get it like that, it's a whole nother thing. So it's really, really cool. Thoughts on ZMAs? So ZMAs can be good. That should be definitely good. How often do you take Hercules Potion? Hercules Potion I would take before any strenuous workout or activity. Another thing is we were talking about today was, so for sexual activity, arginine, right? Arginine, L-citrulline, good for blood flow and vasodilation, which will give you harder, stronger erections, hopefully. It'll increase the blood flow everywhere in the body, and it's used for that. So at that point, you should look into it for that too, because it can work in a whole bunch of different functions. If you take it one day, I mean, you're using it for your training, your activity. You're using it for, the sexual function part of it, for overall health, getting these amino acids in the system, because your body is absorbing and using these amino acids, which are proteins and building blocks of protein, I should say. At that point, it's good overall health for you guys. So my T was tested, it was low, and my total free testosterone was low as well. All right, so it sounds like you are in a bad position there. So let's talk about that. So total testosterone and free testosterone. So total testosterone, I got this question today. What is total testosterone and what is free testosterone? So how does that look in a blood test, and why do we test these things? So we look at total testosterone. Total testosterone, think about it like a gas tank, okay? You got your gas tank, your reservoir. And that's what your total is and how much is in that gas tank. So if it's full, like 90% full, you're good, right? 90% full, you got your reservoir. Now you have your free testosterone. That's what you're taking from that reservoir, what's coming through and what's bioavailable in the body. So at that point, you really want your free testosterone to be up, optimal. So your body's utilizing that free testosterone. It's pumping, boom, 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 boom. So you want your total and your free to be at good ranges and optimal. If you have one that's off. So usually, if you have a good total, like let's say you have like a 700 total or 800 total, but your free is deficient, clinically deficient, that means underneath the range on the scale. So if it's at that point, you're probably going to have a lot more symptoms than a guy that has a lower total, let's say 400, but has a very, very good free. Because at least he's taking from that reservoir as much as possible. Now, it might not be that much, but he's utilizing it and he might feel better than you do. It just all depends, and everybody's different. That's why blood testing and going with this new patient paperwork, health history, family history, and looking at all this with the medical doctor in like a 45-minute consultation is very, very key. It's very, very essential for your health, and it's very, very, it's important for you to understand what's going on because you're going to take the medications possibly, and you want to know what the effects are, how's it going to help you, where's this going to take you. So that's kind of where it's at. I mean, it's really, really cool. What's up, guys? How you doing? Wow, DC Baker, man. I got all kinds of people on here. Sorry, I am just rambling on here, ain't I? All right. Let's talk about some of the events real quick. So, what events do we got going on? We got all kinds of events going on and coming up. So, event-wise, we have our first one next, I think, is the Deke Warner Classic, right?
Yes.
So, Deke Warner Classic. I can't wait. This is in June. I can't wait. So, the Deke Warner Classic, I'm really, really happy to be a part of this with Deke Warner. It's Saturday, June 15th, 2019. You can check out everything. We'll have all this information in our newsletter for you guys to check out, the website, and get tickets and all that good stuff. The big thing about this is, if you didn't see the flyer, we're going to have Mr. Olympia there. The real Mr. Olympia. Okay, so all these other classes, I know physique and all that, they're like, there's a Mr. O of that. But the true Mr. Olympia is the heavyweight bodybuilding champion, and that's Sean Roden. So if you guys don't know who Sean Roden is, look him up. I'm sure you guys can find him on Instagram and Facebook, or you can probably look him up in any bodybuilder forum or website that deals with bodybuilding. Sean Roden. So he did beat my buddy Phil Heath last year, and Phil was a 7-time champion. So that's something to be proud of too. But Sean has took the title and he's rolling a rock and rolling. So I'm anxious to see what Sean looks like, man, because it's really, really cool. I heard he's a humble guy. Can't wait. It's going to be awesome. So if you guys are going to do a show in June, this is the one to do. June 15th, the real Mr. Olympia is going to be there in the house, and he's going to be showing what's up on his guest posing, probably taking pictures, and being a real nice guy like I always is. He's always been real nice. So I am anxious to meet him, talk with him, and see what is up. So that was good. Wow, T was 182 and 3.3. You definitely need some help. What up, Eric? How you doing, man? Topo, my man. All right. Oh, sorry about that. Show you. All right.
You want to let them know what you're doing? Because I've got questions about, like, why is he over here?
Oh, why am I over there? Okay, so what am I doing when I'm going over here? You guys are questioning. So Instagram will not let us incorporate this nice thing that you guys are seeing on Facebook and YouTube. So I have to do like a green screen through my phone. I have to get on the Instagram app and I have to go live through that so they can at least get the live presentation, but they get a green screen and back. They don't get the nice presentation. So when I'm over there, I have actually questions from these people that are on there too as well. So I try to answer them because I get two totally different crowds on Facebook and Instagram. It's really crazy. And people like different platforms. So I want to be responsive to all the platforms at once. So I'm going to get to Facebook because I don't want you guys to feel left out either, right? So what do we got for questions from there? Let's see what's up.
Oh, boy.
Wish we could been there soon. Oh, yeah, I know. So our Angela Trulison, her and her man are awesome. I'm really, really happy to have them on the team. This is a family thing. Next year, I think me should wear GoPro during the expo. We might do some GoPro. I don't know about a helmet. She won't want her hair messed up. What up, Jessica? How you doing? Neil, what's going on? Yes, most MDs are uncomfortable talking about HRT. So if you go into HRT and you start talking to them, they could be very uncomfortable. I've seen some think that they're drug, seekers, steroid abusers. There's a lot of different things. And, believe it or not, doctors are people just like us. And some doctors do not like us guys that have muscle or people that want muscle or they don't believe in it. And they will stereotype you as a steroid user or an abuser or if anything like that. So at that point, it's just some people can be judgmental, some people aren't, but everybody's, is what it is. So if you guys do want to look into different things like that and you guys are getting judged by your general practitioner or somebody else that's treating you, you guys can always call us. There's plenty of other places out there that can help you too as well. All right. And I always say, hey, listen, at least test and see what's up. What up, RB Clay? How you doing, man? So all kinds of people on here. What else we got? Okay. If you hit a plateau with weight loss, what product would you recommend to help enhance weight loss? All right, so Jessica, that's a really, really good question, right? But it is kind of a broad question because we got to say, hey, listen, what are you doing currently? How's the diet? How's the training? Have you increased in some of these different things and progressed, right? Now, if you say and then I got to say, hey, listen, what are you doing currently? Are you doing any supplementation? Is there anything else medication-wise that you're taking? That's when the doctor would come and play and would really assess, hey, listen, there's different medications you might be taking that could interact with medications that they might prescribe. But the ECA Stack Plus is awesome. That will really accelerate as far as fat loss, energy, concentration. So at that point, you will get a lot of great effects from that. That's what I get from it every day. It will help with a lot of different things as far as water weight too as well. You can pair that with the Titan Complete, which they're all natural. As far as injectables with the B complex for natural energy, stimulating metabolism, processing fats to the liver faster. It's got Mick in there as far as that goes. So you hear these super Mick shots or super lipotropic shots. That's garbage, man. All it is Mick and B12, right? So you're getting 4 components in there, Mick and B12. With us, you're getting Mick, you're getting the B complex, full spectrum, B12, all 3 and only the 3 branched chain amino acids, leucine, isoleucine, and valine, and you're getting L-carnitine. So at that point, even the L-carnitine, all of these things together are synergistically working to help get you the result of the weight loss and the boost of metabolism and to help process fats faster and to mobilize fats faster in the body. So it should get you a better result. So those are the 2. Now, when you start talking about you're hitting a plateau and you're doing everything right, the training's progressing, the eating's on point, you might be taking some of these ECAs and stuff like that. Now, there's still a problem. You still can't get it or you're gaining weight. That's when you really want to start looking at blood testing. That will really tell you the key because there could be hormones off. And when hormones are off, this is a common problem that people are not aware about. When their hormones are off, they have no idea. They go and they said, you know what? I'm really going to get in shape this year. I'm sick of this. I want to get in shape. I want to feel better. I want to look better. I remember how I used to look when I was 30, 20, 18, whatever it was, and their prime years. And they say, you know what? I'm going to go to the gym. I'm going to start eating healthy. So what do? They start the lifestyle. They start with the one step of trying to eat healthy, right? They start going to the gym or getting a trainer. They go all full blast. They're all into it. They're all motivated. And they keep going, and they start seeing the same thing over and over. Same person in the mirror, same size in the clothes. Just nothing is changing. They're starting to get unmotivated, right? They're starting to come down and getting depressed to a certain extent. They're looking at themselves and saying, why am I doing this? You know what? I'll just go back to doing what I was doing and I'll be just the exact same. So that's really where the problem's at. If they looked at possibly some of these things like hormones, if their hormones are off, it could cause a lot of these different issues like fat deposits being in the body or more fat deposits staying in the body, or you're just not feeling good, not having the energy to train or do the activity. A lot of different things. Even hormones can affect depression in the way that you think in your mind state. So these things need to be on point. They need to be optimal and they should be correct. So the blood testing should tell you that. With the plateau, that's kind of where it goes. Progress. We have some therapies that will definitely help with that as long as you're doing it. All right. Fast AM cardio, weight training, 5-6 days a week. All right, it's called decent clean diet. So decent clean diet tells me you are not eating a clean diet. Decent clean diet means that you're eating a clean diet probably 4 or 5 days a week, and you're entering either some drinking,
Decent.
right?
That's the word.
Decent. So if you told me, hey, listen, I am on a strict clean diet, that tells me that you're on a clean diet, Jessica. But listen, we all got to start somewhere. So I'm not saying go to extremes and you're eating fish and broccoli and white rice and you're eating it 3 times a day. Listen, that's not optimal or it's not going to be realistic, okay, for some people. So at that point, you start somewhere and then you progress, right? Get better and better and better, right? You don't have to start and go from 0 to 100, but definitely keep going as far as you can, as fast as you can, okay? All right, and that's everything. All right.
Found the culprit.
All right, so cookies, yeah. All right, so I like cookies too. Trust me, I am a Haagen-Dazs. Anybody that knows me and sees me, they know, right? I could never be a competitor because I'm not going to be that strict. I do eat clean most of the time, right? And I train as much as possible. That's 2 or 3 times a week now. But I want to make sure that I'm cognitive or I'm like focused. Like I know that I need to eat a good amount clean most of the time. And at that point, I can throw in some cookies or some Haagen-Dazs or whatever it is, and still say the same about the same. I always want to progress, so I always want to get leaner. I want to get stronger, obviously. So that's what I'm looking at right now. I'm getting over injury. It's getting a lot better. Shoulder problem again. BPC has came through, and I talk about the training there. So when you do have some shoulder issues, I'll start posting up some rehabilitation videos that I do for my shoulder, and maybe it'll help you. It's a common problem. I know with a lot of guys benching and stuff like that. And here's the real issue with some of the problem is some guys, they only work certain muscles. So if you overcompensate on those muscles, and let's say you're not working on your shoulders, you can actually do damage to your shoulders. It just really, you're building up one area and the other areas are not built up with it. So it does the same thing with ligaments and stuff like that. So you build muscle quicker than ligaments as far as that goes. So at that point, make sure you guys are being safe as far as training and stuff like that. All right. So I think that's pretty much about it, right? We got Lee and Kevin. They're still visiting. PCA July 7th, Miami. It's going to be a nice little show. We'll be down in Miami representing. That's going to be awesome. Ian Harris will be in the house. Jeff Culp will be out there. I'll have a lot of different people out there, man. So I'm really excited about that event. I'm excited about doing Miami. What else we got? We got Seminole NPC and the NPC Iron Bay. My man Jose Santiago. It's on Tran. We're going to do it big this year, guys. National qualifier. Oh, man. I'm really, really excited. I'm really excited for Jose and them. And they've done really, really great thing with this. It's got a hero division for the Iron Bay Classic. I'm excited about that. It's awesome. And don't forget, we have the Leo specials going on for all HRT and all therapies, except for, I think, peptides. So at that point, if you're looking for HRT, you're looking for blood testing, you're looking for any of our amino acid and vitamin injectables, if you are Leo, you should know what that means. If you are Leo, you will get substantial discounts, and it's still going on right now. So take advantage of it, because I'm going to grandfather you guys in, but it will be going away soon. So I want to make sure I fill it out for you guys, and you guys take advantage of it. Also, Lee and Kevin are still here. So Lee Shalacott, my IBB Pro, I brought her in from South Africa. She was happy enough to bring Kevin, her boyfriend, really, really good guy. And they've been here for about 2 weeks, I think. They were at Europa with us. There was a lot of footage of them. You'll see them right here. They're in Orlando right now at Disney World. I think they're at Universal Studios. Seeing that, see the Transformers. I told them about all the good stuff. I took them to Busch Gardens. They love roller coasters. Just a whole different culture. I'll have them in the studio before they leave to do a video or a live, so you guys can see. We can kind of talk about their experience here. Hopefully we can bring them more permanently. That'd be awesome, right? So that's really, really cool. It's been awesome training with them. Been awesome talking with them. Just like I said, a whole different world, a whole different culture. When you get to talk to these people from the different countries and they tell you what's kind of going on over there, and you kind of just realize or think about it in your mind, you're like, wow, it's some humbling stuff, man. I mean, what they say, like what we have, like even some of their videos when they went to Walmart, so with that, some of the things that we have access to that some of these other countries do not, it's crazy, right? You don't even think about it. You get up out of bed, you have pretty much anything at your fingertips. Any Uber Eats is going to bring you any restaurant anymore, right? I shop through Instacart. It gets delivered to my door. I mean, things are so simple and so easy. It's just given to us now. So it really puts things in light where they come from and what they're going through right now out there. It's nuts. So it's really, really cool too to learn. I love learning about other cultures. All right, we already talked about therapy of the week. Europa. If you guys did see us at Europa, I hope we met expectations, and I hope you guys got shirts or Titan gear. I had all kinds of special Titan gear out there. Guys, I have all kinds of Titan gear for you guys. I've got the jumpsuits in still, so if you guys are looking to buy the jumpsuits, I still got some of the Titan Nike jumpsuits. I'm getting more of those made. Those were a big hit. The hoodies, these Nike Titan shirts, they're fitted. They're awesome. Leggings, joggers. I mean, man, we got all kinds of stuff coming at you guys this year. I promise you, Titan's going to take it to a whole nother level. So I hope you guys are ready because the Titan train is coming through. Choo-choo. I promise you that. Hashtag. I need you guys to all hashtag me. Hashtag Titan Medical, right? Hashtag Team Titan. At Titan Medical. I want that, please. And also, I want to give away a couple things. All right, so I'm going to do a three-part giveaway today. First giveaway, because, me and Jeff have worked really hard on our book. I don't plug it enough, I guess. I just really, really like that. I don't like to do the plug. But I'm going to plug it. The Ultimate Health Bible, right? Your guide to anti-aging, fat loss, and disease prevention. If you guys don't see it, see it here. Now you guys can get it anywhere. Barnes & Nobles, Amazon, Kindle. It's all there. So if you're an amateur, this has a lot of valuable information as far as eating, dieting, training. It's got hormones. It's got all kinds of different stuff in here. If you are a seasoned veteran, I promise you, you will still pick up something out of this book. And if you don't, I'll buy it back from you. So there's the test. I promise you, there's the challenge. Now, we've had all kinds of people review this book, as far as fitness gurus, Hollywood trainers, to the celebrities, and we've got some really, really good reviews. So I'm really, really happy we're announcing these reviews and putting them on Facebook and stuff like that. Get your copy. It's very, very cheap. Now, what I want to do is I'm going to do a giveaway for a book. I'll do a signed copy of the book. And what I'm going to do is hashtag Titan Book. All you got to do is 727, text it to 727-389-3220. I'm also going to give away a gift certificate. Hashtag Titan Gift. So hashtag Titan Book, hashtag Titan Gift, and hashtag Titan Gear. I'm going to give away a free piece of Titan gear, whatever it may be. I've got these awesome Nike hats, shirts, all kinds of stuff for you guys. So hashtag Titan Book, hashtag Titan Gift, and hashtag Titan Gear. And text that to 727-389-3220. If you guys have not subscribed to our YouTube channel, go there and subscribe. If you're on there, please press the button. And please give me a thumbs up if you guys like this. All right? I'll keep coming with more content, more information. Write me in what you want. Facebook, Instagram, keep it locked to here. You guys are killing it. I appreciate it. I love the support. Me and Tsikouris really, really appreciate it. The whole team appreciates it. And we're growing more than ever because of you guys. So remember, be Titan strong. There is no alternative. I'm John with Titan Medical Center, and I appreciate you guys tuning in.